for what I'm sure will be a great and informative webinar on case management and influenza, case management of the influenza and pneumonia patient with homeopathy during the COVID-19 pandemic. So be an update with Dr. Andre Saine. I'm Dr. Alex Becker, general practice physician specializing in homeopathy. I'm a board member of the American Institute of Homeopathy and the editor of the American Journal of Homeopathic Medicine. The American Institute of Homeopathy is honored to present this event to the public. We'd also be happy if the participants were to consider joining the American Institute of Homeopathy, which is the oldest extant medical organization in North America, to be involved in all that it's doing, and also consider making a donation to the AAH to support webinars like this and other educational activities. It is my privilege and honor to introduce to you the speaker, Dr. Andre Saine. Dr. Saine is a 1982 graduate of the National College of Naturopathic Medicine in Portland, Oregon. He's board certified in homeopathy by the Homeopathic Academy of Naturopathic Physicians and has been teaching and lecturing on homeopathy since 1985. He's considered one of the world's foremost experts on the subject of homeopathy, lecturing in Canada, the US, and many European countries. He's known as a homeopathic scholar based on his in-depth studies of the work of the great masters of the past and based on his practice of pure Hahnemannian homeopathy. He's also a leading expert internationally on the historical, epidemiological evidence for the effectiveness of homeopathy during the epidemics of the last 200 years. One of the main points of his clinical work is the homeopathic treatment of patients suffering from very serious chronic disease. Without further ado, I will have Dr. Saine start our webinar. Thank you very much.
Thank you, Alex. I can't wait to hear what I have to say now. Welcome everybody to this webinar. We had a series of webinars so far on the COVID epidemic. And the title is a bit different than the one that Dr. Becker mentioned. It's not about influenza and pneumonia now, because we're just going to dive directly into the treatment of the COVID-19 patient with genuine homeopathy, and it will be an update. All the material here is new, so it was never presented before. So today we will review in greater detail the extent of the COVID-19 pathology, some of the clinical results so far obtained, and the mathematical of some of the most indicated remedies. A copy of this document, which is about 86 pages long, and the recording of this webinar will be available on the home pages of the American Institute of Homeopathy and the Canadian Academy of Homeopathy. I will reiterate what my colleague Alex said. We're asking healthcare professionals to consider joining the American Institute of Homeopathy, even as foreign members. So even if you are not from the United States, as in union, there is strength. As well, we're asking members of the entire homeopathic community to consider making a donation to either or both of today's webinar sponsoring organization in order to enable them to continue offering free webinar like this and other educational material and activities. I want to remind our colleagues that there's a data bank that you can access by contacting Mr. Peter Gold, and in order to enter your cases. So please do that. It would be very rewarding for the whole community. So what we're going to cover today, first we're going to look at the repertorial analysis of the pathology of COVID. So we're going to look at the early stage, pneumonia stage, let's say moderate to severe, and then the critical stage. And we're going to look at also from the report of pathology, autopsy, and intubation outcomes. I will review a series of typical cases of COVID patients treated with homeopathy, of severe cases, a series of 6 cases of COVID from Istanbul, mostly in hospital cases. the management of complex suspected COVID case, my experience in a nursing home in France. We're going to review the differential mathematical, which is completely different than when we first did this, because at the beginning, we were speculating about what possible remedy would be. Now we don't need to speculate anymore. Now we can say what we have seen and what would be the best remedy for prophylaxis. And we're going to review some of the mathematics of the most common indicated remedy. And again, we're going to, I will emphasize carbonium oxygenizatum. And finally, we will end why we should knock at every door to request clinical and prophylaxis trial with homeopathy. Okay, so if we look at the common symptom to almost all patients, especially in the early stage. So I'm going to go directly right now to the repertory. So here are the common symptom: the short dry cough, the sore throat, the remittent fever, that means fever that comes up and down. Sometimes it can be intense, now it's above 39, especially in young people. The weakness that is very typical of this condition, great weakness during fever or chill. Chill and fever should be put together. The sudden weakness, so it's characterized by sudden. Some people, overnight, they wake up and they have no energy. They went from feeling fairly well the night before, and they wake up in the morning and they don't really have much energy. Characteristic to almost all patients with COVID, they feel oppression of the chest, like a pressure on the chest. Some will develop pneumonia, and the characteristic of the pneumonia will be ground glass appearance. They will have difficulty breathing with or without confirmed pneumonia. There will be one of the characteristics of the difficulty breathing is they have difficulty taking a deep breath. They say, I tried to take a deep breath, but it just doesn't go in easy. Like it says here, if something is going on in my lung, or no, it's not here, it's a bit later. I have it someplace else where they say, I just tried to take a deep breath, but I can't. It's partly due to the oppression of the chest. Sometimes some people will feel constriction of the chest. Many people will report loss of taste and smell. As a rule, they have no appetite at all. And very frequently, the tongue will be white. So this is the early symptom and common to almost all patients. So let's look at other symptoms that we will see that are maybe not shared by the majority, but are very common symptoms that you will see with patients with COVID. Okay, so these are the symptoms I was describing. You know, the cough worse from breathing, inspiration, talking, the chest pain, the headache, the muscle ache, the scanty expectoration, the alteration of taste, and the dryness. So then we talk here about the coryza, the sneezing, the epistaxis, and red eyes, so conjunctivitis, very common. And especially in more advanced case. Sleepiness, many will say they have never slept so much. They will sleep all night long, 10, 12 hours at night, and maybe up to 10 hours during the day. So they're barely awake 4 or 5 hours in 24-hour period. Chilblain has been reported. I've not seen it, but it's been reported as quite common. And so with the blisters, chilblains would be especially common more in children. So now let's look at the symptom of, Peter, I changed my screen. Did you see that I changed my screen? My representation? Okay, I'll let, okay, so now we have the symptom of the advanced stage when there is dyspnea. So I'll lower this. So here we have like great difficulty breathing. The breathing is rapid.
Sorry, Andre, it's not refreshing.
I have to refresh again?
Yeah, it's not refreshing the screen for some reason.
I think we are on a new screen.
It
so
says
what is your
respiration difficult.
Yep, we're different. We're new screen.
Okay, very good. Okay, so there's abdominal breathing, very superficial breathing. The breathing will be loud, forceful, vehement breathing. You could use Saine, like Some people will moan. You could use also stertorous breathing. I didn't put it here, but I will put it right now, stertorous. Let's do stertorous. Do you see that I'm moving my, going to the repertory, Peter?
Yes, I can see you're moving through the
Okay, very
repertory.
good.
No problem.
Okay, very good. So sighing is a good one because very, very common in the state of great dyspnea, of great shortness of breath. They are kind of sighing, breathing. So then they reach a point of asphyxia where there will be cyanosis, or you'll see the pulse going down, the temperature going down. The mouth is wide open to breathe. They're unconscious. The pulse will start to be very, very rapid in the beginning of asphyxia, and later on it will be slow. That as asphyxia progress, the pulse goes down, as so is the body temperature goes down, and that is signs of that will precede death. So here, if we look, I'm going to the Word document now. Peter, tell me if you see the Word document. You see it?
No, I do not. I still see the representation.
Okay, so I'll refresh the screen then. Okay, so here if we look from pathology report, scan, and I could say also autopsy, and post-intubation outcome. Here we have a summary from the magazine Science of April 24. It's called A Rampage Through the Body. So it describes all the different pathology that is associated with the virus. And there's a nice diagram here. Actually, everywhere there's an ACE rich cells, a cell that has receptor for ACE, such as the mucous membrane of the mouth, the tongue, the respiratory tract, the arteries, the heart, the kidneys, the intestine, the neural cortex, the brainstem. All of this are very, very rich in ACE receptors, and which serves as the entry point for the coronavirus. So all of these tissue can be damaged, and here you see all the different part of the body that have these receptors that will tend to be that the virus will penetrate the cell and multiply itself in the cell. So these are the tissue, and so this would lead to this form of pathology here: thrombosis, microvascular thrombosis in the lungs and other tissue, apoplexy. A lot of cases of stroke have been reported, especially in younger people. Inflammation of the heart, of the pericardium, with arrhythmia, retiform purpura, which we'll see some picture of it, encephalitis and meningitis, hepatitis, inflammation of the liver. They don't know if it's due to the virus or it's a secondary effect of the inflammatory process going on in the body. Anyway, there's the liver will be enlarged and inflamed, kidney failure, proteinuria, hematuria, conjunctivitis, and acral erythema, and so on. So let's go back to the repertorization of all the, well, before we do that, I'll just show you the picture because we will not need to do that afterwards. So here are some of the, like we could say almost purpura of the skin, very, very severe, or of the extremity, the toes, the acral erythema, or chilblains. I have more about chilblains. So here's the COVID toes, the chilblains, and especially in children, they will say, and young adults. I have not seen it because maybe I didn't treat any children or many young adults. I treat a few young adults, but not many. And here's a picture of this chilblains. You can see it. You see that, Peter, right?
Yes.
Okay, very good. So you see some, there are blisters at times, like here there's a blister. Okay, there's some blisters, like here there's a blister again. So, so this is, and let's look at the repertory. I'm changing screen. You tell me, Peter, if you see the repertory now.
I do not.
Okay, so I'll have to.
So it looks like each time you go to the repertoire, you'll need to refresh.
Right, it seems to be. So if we look, so here is in terms of the pathology report and the autopsy, these will be the rubric that will represent the symptom we just reviewed, like the chilblains. That's the end of the finger. There will be pustules and vesicle at the end of the fingers and toes, and the purpura. Now, if we look at the materia medica now of the first stage, so if we look at the materia of the first stage, these are the remedies that are highly represented by these symptoms. There are many, as you can see. And here it's a bit later stage with the breathing and the severe headache and so on. This would be in the asphyxia state. Here you see opium, antimonium, phosphorus. These are arsenicum, carbonium oxygenatum. These are remedies that have been used with success in that stage. And here is the related to the pathology from autopsy and so on. However, if we put all of them together now, let's see what happens if we put all of these together. So here, so if we look at all of these, I think it's all the rubrics are here. So these are the remedies that will be more commonly indicated in COVID. That will present. So therefore, you have to use this this kind of representation, and then you have to individualize to each patient which remedy each patient needs. One, I want to point out that I did add about maybe 1/6 of the symptom of carbonium oxygenatum into the repertory, so not all of them, but I want to show you that it's very well represented especially for the difficulty respiration for the late stage. But I'll come back to that. I want to show you this. Hold on a second. So for sure in the late stage, it will be highly represented. I want to show you this rubric, which is a new rubric, which is here's a Brownia for ground glass appearance. So it has reversed that. And so carbonium oxygenatum has produced it. So these are two remedies that we know are related to ground glass appearance of the lungs. Okay, very good. So now I'm going to go back to the text. I'll come back and share it again. Where's my text? No, that's not it. Let's share my screen. No, I'm sorry. It's not this. Okay, let me just look where it is. It would be word. Oh, it seems to have disappeared. Here it is. Oh, it's not this. I'm sorry, I cannot find the, oh, it's here, okay, the picture, okay. There we go. Okay, so let's move forward now. Here's Christoph Aberman from Austria sent me some autopsy report from Italy. So it confirms about what we said about the lungs and the thrombosis. Now I'm going to, here there are a series of cases that were treated with homeopathy. These are severe cases, COVID patient treated with homeopathy. I will not go through them. I will let people read them eventually by yourself. The 4 of the cases were tested positive, and there's one suspected case, number 2, was not tested, and they will say why she was not tested. You'll see when you read the case number 2. you will notice that 4 of the cases who tested positive, the 4 cases that test positive were all medical personnel, 3 of which became sick while treating COVID patient in the hospital. Common to all cases, they were progressively getting worse until they took homeopathic remedy, which marked the beginning of their steady recovery. In the first case, it's a nurse from New York. The patient was quite sick for 10 days before the remedy was taken, and major signs of recovery were manifested by the 18th hour after the dose was taken. So we'll review maybe the first case. Here is a 41-year-old nurse from a hospital in New York City working in the emergency room. The department didn't have appropriate protective equipment, so they had no masks, even though they were in an emergency room with hundreds of patients coming in with COVID. They didn't have masks for 3 days, and 9 of the 12 nurses on her group of nurses developed COVID within a week. She first became sick on the 24th of March. I took a case okay, here, it doesn't say where, but I took a case maybe, yeah, I didn't talk to her, I talked to a nurse. So here she was quite sick. She couldn't get up, she could barely talk, she could not walk anymore. So she was totally out of it, like horrible shortness of breath. She cannot ascend stairs. She was told by a physician to go to the emergency room as a patient, not as a nurse, which she refused to do, as she knew she would get worse there. She has pronounced shortness of breath, which is worse stooping, walking, ascending stairs, and talking. She's experiencing extreme weakness, which is worse from the slightest exertion. She's too weak to walk. She cannot get out of bed anymore. She feels really scared. Her doctor insists again that she goes to the ER, but she again refused. She said she knew something was seriously wrong when she couldn't get a blood pressure reading while standing. It was 90/50 while sitting and 124/72 supine. And her resting pulse was 109. So the remedy was prescribed on Friday, the 3rd of April. However, they didn't go out to get the remedy. They were from New York City, but they didn't go out to get the remedy from a pharmacy. They ordered it online. And they didn't get the remedy until the following Tuesday, the 7th, at 2 o'clock in the afternoon. It arrived. And I asked her, how were you between the 3rd and the 7th, between the time I took your case and the time you received the remedy? She says, I remain as bad as ever. She ended up taking 4 doses of sulfur 200 on Tuesday, April 7th. On April 8th, the next day, she woke up feeling much, much better. She was able to walk, descend and ascend stairs, almost like normal. She cleaned her apartment and cooked on that day. On April 10th, so on the 3rd day after taking the remedy, 7th, 8th, 9th, 10th, the 4th day after taking the remedy, she felt 98% recover. Her energy was up at 9.5 out of 10. It was 5 at rest during the previous 10 days, but it would drop to 0.1 with the slightest exertion. She was told to consume the sulfur twice a day for the next 2 weeks, and if at any time she would experience flu-like symptoms, to take sulfur every hour for 3 doses, and to call her homeopathic physician. So this is a rule here for all patients with COVID. She said that she doesn't want to go back to the ER because the working conditions are not safe enough. As of April 21st, she remained recovered and had returned working in the emergency room as of Sunday, April 19th. She reported that 5 or 6 of the nurses of her group were still out. There were now much less COVID patients in the ER. At the height of the epidemic, when she got sick, they were seeing up to 100 COVID patients per shift. So that's a lot. That's about 300 patients a day. They had no place to put them. Many were not attended to before hours later, sometimes the next shift, sometimes the next day. The number of COVID patients has now, she told me on the 21st of April, had dropped about 10 to 15 per shift. So this is a case where the patient was sick until she took the remedy. improvement occurred very quickly. Within 18 hours, she was greatly better, and within 4 days, she was 98% better. And she remained better. Afterwards, she repeated the remedy like I told her, but she stopped before I talked to her. I think she took it for maybe a week after I talked to her, on the maybe on the 11th. Okay, here's another case from New York. It's an interesting case, and now I'm going to read it. I'm not going to read all the cases here, but I'll just go over this one. So she was a patient of mine from 2002. She came to me because she had progressive weakness, emaciation of her left arm that followed a very severe bacterial infection. She felt she was dying at that time, and she always tell me, Dr. Saine, you have saved my life. You have saved my, not every time, but many times when I've not talked to her for a long time. She says, I want you to know that you have saved my life at that time. In any case, she's part of a religious Orthodox community that has been devastated by the COVID in New York. Her husband and 3 other children and 3 older children fell sick to COVID. She said that every other member of her community has fallen sick to it. A lot have so far been hospitalized, and over 250 members of her community have died from COVID, and over 100 between 20 and 40 years old have died. She was asked if she was tested for the COVID, and she answered no, because the line goes around the block. Look online and you will see for yourself. And nobody wants to go to the hospital. They bring you there by ambulance and you are at the same place the next day. No one has taken care of you during this time. She told me that they have a special ambulance for this community in New York. And I mean, they have their own ambulance, and the ambulance would drive a patient to the hospital, drop it at the emergency room, go back to the community, pick up another patient, drop again at the emergency room. And the patient that was dropped an hour before has not been cared for. And the ambulance would just go back and forth from the community back to the hospital. And the ambulance person says the person that he brought the day before was still there unattended. And on the second day, after, or maybe on the third day after bringing that first patient there, says that patient was still at the same place, but this time was dead. That's what she reported to me. So I tried to confirm this with physician and nurse in New York, and they say absolutely it's true. It says they couldn't handle so many patients. They opened rooms to put COVID patient off the emergency room because there was not enough space, and many people were put in those rooms, and there was no personnel to take care of them. Many of the personnel were sick, so they were understaffed, and they couldn't handle all those people. So here I wouldn't. She says she was very worried because people are falling like flies in her community. So here the symptoms are described. I will let you read them. She was given her chronic remedy, which was sulfur, She felt better, but then she relapsed with a new set of symptoms. I will let you read about it. She was given brownia, felt much better. And she says she only needs three doses, and she was much better. And so eventually she recovered completely, 100% with the brownia. And I told her at the end, I said, okay, so she's fine today. It says April 14th, she's fine today. She was told to take brownia 1 m each night before bed for 1 or 2 weeks. And with any sign of relapse, to take a brownia 1 m every hour for 3 doses. If there would be a problem, to not hesitate to call back. She was told to tell the people of her community that they don't need to die like flies because of a dogma imposed by medical establishment that homeopathy is not effective. To the contrary, homeopathy is extremely effective, safe, and quick, while the conventional model has shown to be helpless to deal with such an epidemic. The third case is a university professor of medicine from Istanbul. 2 of his colleagues have died, who have worked with COVID patient in the emergency room, and university professor have died. So a third one contacted me, another professor contacted me to see if we could help the other ones. And this first case received arsenicum and recovered. By the 7th, he was fully recovered, and we started treatment. We started the treatment on the 5th. So within 48 hours, he had stopped homeopathic treatment. And the last time I inquired, on the 17th of April, he was fine. So he did a complete recovery. The case number 6 is another doctor who became sick by treating people, COVID patient in a hospital. So you'll have the story there. I will let you read it. Here you have a bit more lab. The D-dimer was elevated, and we had a few patients with the D-dimer elevated. He was prescribed phosphorus, and you see some of the labs here. You'll be able to appreciate the lab. I think the remedy was given on the 6th, I think, or the 5th, the next day. The remedy was given on the 5th. So you'll see here, this is the 5th when the remedy was increased. See, like the ferritin is at the highest point here. The D-dimer is the highest point here. Platelets, okay, it's fine. And the white blood cell, the lowest here. Let me see, I think there's more. Yeah, and the lymph, look at the lymph, the lowest. So the remedy is given on the 5th. On the 6th, ferritin drops. CRP, which was very high, drops. It's funny, I didn't put a D-dimer there. There was D-dimer too. We had D-dimer result. The platelets start to rise. The white blood cells start to rise. So all of these should be L, like low. This is low. This is still low because 150 usually is the norm. See, this is all low. Low numbers. And here the lymph, you see the lymph starting to go up. Look at this within a few days. The only change is the remedy. The 5th person is my nephew, who is a young orthopedic surgeon. He's 29 years old. He became ill. He doesn't know how he became ill. He doesn't know if it was in the hospital or he met also a colleague from other place of Canada for his board with the Royal College of Physician. And so he got sick and he recovered with another remedy, which was Nature Muriaticum, if I recall. I'm quite sure. Doesn't say here. And well, yeah, it says here, Nature Muriaticum. Now, what's interesting here, I present 5 severe cases of COVID. All tested positive, except one, she didn't want to go be tested. But all 5 receive a different remedy. So out of the 5 cases, 5 different remedy. So it shows the individuation process. Now, here's a series of 6 cases of COVID from Istanbul that I treated with my friend, Dr. Sapir Diller from Istanbul. He's a university professor of medicine. He's an integrative oncologist. And during the COVID epidemic, he was asked to support his colleague in the emergency room, like many of the university professors were asked to go down to the emergency room to give a hand. He had lost also 2 colleagues to COVID. They had died, and it was quite a shock in the community. So he decided to after I think our first webinar, he decided to see if we could support him with homeopathy. So there are 6 cases here, but in total there's 8 cases. The last 2 cases, they have been prescribed only this week, so they were not included, but they're already better from the last, from the first report I got. They all got better. Case 2 and 3 were summarized in the above series. The one we saw, the 2 physicians, it's case 2 and 3, and they're summarized here. However, in the following description here, and I will not go over it, you will see the narrative between the 2 physicians, Dr. Sapir Diller from Istanbul, I should put. From Istanbul, and myself. So you'll see here the description of the case. I think the first case we review during one of the webinar. But you can see here it says A, that's me, that's the answer, or Andre. So he asked me a question, like here it says, he reports something on March 31st, and then you'll see A, and that's the answer. So you'll see the exchange between me and Dr. Diller, who may be actually online right now. Okay, very good. So if we, I will skip these 6 cases. You can follow them. There's a case, I think out of the 6 cases, there's 1 case of Brownia. No, not Brownia. Out of the 6 cases, there's, well, we could say out of the 8 cases, 2 are not typed, 2 are not included. But out of the 8 cases that so far was prescribed from the Istanbul series, 5 are Brownia out of the 8. 1 is arsenicum album, 1 is phosphorus, and the other one, I'm not sure, I can't remember. I'm not sure. So, but you can see that the majority, 5 of the 8 at least, are Brownia. So I will skip these cases. I will let you review them. They're all very interesting, especially with the I say the narrative, but it's not the narrative, it's the dialogue between me and Dr. Diller. So dialogue. Okay, so now we're gonna go to here there's a case that had a swollen hand, and you'll see I put the picture here of the swollen hand of the patient, and that would be part of the probably likely, because I asked if there was a bite, like if a cat or an injury, and it was not the finger, it was only the hand. So it's something to do probably with an inflammation there. Was it related to a thrombosis? We don't know, but it lasted only, see, I asked, it could be a cat bite or a small cut. And here it says, the menses became very painful and strained and should be related, and it should not be related to the remedy. I said that at that time. However, I found out since that there is a surge of blood to the uterus and associated with COVID. So I said, we know that the virus can not only affect the lining of the respiratory tract, but also the digestive tract, kidney, the heart, and the brain. I wonder if in any case it is also affecting the uterus. Oh, he's writing this. But now we know, yes, it can, because I found some literature where it says there is increased bleeding and pressure in the uterus from more blood to the uterus. Anyway, I will leave this for you to read, this series of cases, with the dialogue between the 2 physicians. Next would be the management of complex suspect COVID case. Why suspected? Because none of them, except one went to be checked, was negative, but it's probably a false negative, but none of the other went to be checked. So here, the first case is a patient with a chronic disease, has COVID. These are all patients of mine that has return of false symptom. So I will not review it here. I will let you do it, but you'll see what do we do when there's return of false symptom coming back. And here she says, like she developed back pain and so on. So the interesting part here is different remedy need to be given while she was given the acute remedy. For instance, here she started to have like lung pain, and phosphorus was prescribed. This was followed with liver pain, low back pain, and with deep sadness related to her life that she could not enjoy because of the many difficulties of life she had experienced, including the loss of her mother 3 months before and of her father the previous year. She self-prescribed Ignatia 200D, which made no difference, and then Ignatia Tenem, and all became better for the except for the low back pain that was the result of physical exertion, and for which she self-prescribed another dose of her old friend Ruth Stock's MM2H to finally to be completely well, very well, she says. But you see how the grief came back to the surface after the phosphorus. Phosphorus helped the lungs, but it brought to the surface a grief. This had to be taken care of, and the low back pain that was a result of a recurrent low back pain that was a result of strain. She had to use Rustox, and she was very well. This case is, okay, this is a very young person, 19-year-old. We did the COVID test. It will come out on Monday. The result will come out on Monday. It's pretty sure it's COVID from the course of symptom. And he was a patient of mine when he was, I think maybe 9 years old, no, 11 years old, so 9 years. And he had a recurrence of medulloblastoma, for which the family decided to use conservative care. So they didn't do another surgery with radiation. They decided not to do it when it came back because the prognosis was meek. So they decided to go with homeopathy. And he developed, he's in 9-year remission now with no sign of the tumor coming back. However, he developed symptom of COVID with extreme severe sore throat, fairly high fever, almost 104 fever. So that would be 39.9 in Fahrenheit. And what's remarkable about this case is in order to improve, he needed to take the remedy, which was a very high potency, MM8H, every 30 minutes. So before the COVID epidemic, he had not been taking any remedy for a long time, many months or weeks. I cannot be sure because sometimes his mother gave him the remedy. But the last phosphorus he had taken long time before was 7H. So I just decided to go to the 8H. But he had to take the remedy every 30 minutes. Otherwise, the fever would keep relapsing. His symptom would keep relapsing. So he was negative for strep throat. He was tested at the same time for strep throat, which was negative. While the COVID test results are still pending for Monday. But why I'm showing this is because here's a person that, okay, he had a history of radiation. He had a history of chemotherapy when he was quite young, maybe at 7 years old or 6, 7, 8, 9 years old. After the age of, at the age of 11, sorry, he stopped all these treatment. But when he had the COVID, he had a very severe case of COVID in terms of fairly high temperature, very severe sore throat. You see 10 out of 10. Extreme dizziness looking up, which is a symptom of phosphorus, which phosphorus has. Here is the bad taste in the mouth, the soreness, and so on. But in order to be well, which he was relatively well, his wife says he's quite well, despite having 104 fever, more or less. But otherwise, if he didn't take the remedy every 30 minutes, he would relapse very quickly. So maybe there would be a better remedy, but it would be hard to find a better remedy right now because the symptoms still point out to his chronic remedy. However, I think he needs frequent repetition because I will be talking to him right after the webinar today because of his history of the radiotherapy and chemotherapy, probably. Here is a third patient, which is a serious patient, a patient with a serious underlying chronic disease in a suspect COVID patient. Here's a 37-year-old woman who helped a friend of hers who was in crisis with flu-like symptom with great shortness of breath at the height of the COVID epidemic in Spain. So she decided to take a risk because she has a severe chronic disease to go help her friend that couldn't barely function anymore because of shortness of breath. I think she brought her to the hospital or something. She went to help her. But some days later, around April 7th, she began to sneeze with coryza. On the 9th, she experienced dizziness, trembling on rising, and exhaustion. On Friday the 10th, she developed sore throat, intense headache, great fatigue, heaviness of her body, body aches, and feeling of having been sedated. She self-prescribed Brownia 30C and then 200, which helped greatly. Like the throat was 70% better, the cough was 100% better, and so on. And then I prescribed gelsemium when I talked to her because she was still feeling sedated and her body felt very heavy, which lifted with the gelsemium. However, the suspected COVID condition kept relapsing. The suspect COVID condition kept relapsing. Okay, all that's good. Okay, yeah. No, okay, I see. As the suspect COVID condition kept relapsing, the metastatic lymph nodes from a melanoma were growing and becoming more painful. So here you address a chronic, an acute disease, but the chronic is clearly getting worse. Also, as she was relapsing, she began developing severe shortness of breath with chill, oppression of the chest, and great weakness and anxiety. She had difficulty taking a deep breath. Arsenicum album 30 was prescribed, which at first aggravated her symptom and then improved most of them. However, the lymph nodes became even more painful and felt more swollen. So on April 19, her chronic remedy, Conium 200D, was re-prescribed, which helped for the acute condition, but the acute condition became more manifest, especially regarding the shortness of breath. She was prescribed over the coming days Calcarea carbonica and Sambucus. She couldn't find Sambucus 30. It was 11 o'clock at night. She called a colleague who had the 5C. So we used the 5C and she really improved. She was able to sleep. The anxiety went down. The breathing problem went down. But again, the lymph node became more swollen. So on April 22nd, another dose of the conium was prescribed, which quickly helped the pain in the lymph node by 20-30%. So you can follow the case again, and it ended up that she had to, all the symptoms disappeared slowly with different remedy, but the lymph node became acute again when we were dealing with the acute. So every time you were dealing with the acute, the chronic would get worse. Finally, she needed to, the acute was gone by Thursday, that's 2 days ago, and she was told to continue to repeat the Conium 200D as needed. So here's a very complex case, very serious. You don't want the melanoma to progress, and you have to deal also with the acute respiratory distress, dyspnea she was experiencing. Here, the fourth case is a patient that is immunosuppressed. She was diagnosed in October with stage 3 or 4, can recall at least 3, because she had lymph nodes in the mediastinum, and also she had in the liver. So it's stage 3 or 4, small cell lung cancer with a very poor prognosis. She had been a smoker for 40 years. Okay, she developed, she was told to isolate herself in the house because she was immunosuppressed, to not have any family member come to her. So they would serve her the food from the hallway. She would open the door, pick up the food, and so on. However, she still had to leave the house to be get tested at the hospital. The good news is that her oncologist decided to stop treatment as all sign of cancer had disappeared, to his surprise. The bad news is that on April 21st, she developed a 38 fever and chills with headache, dry cough, shortness of breath, the typical symptom of COVID. She responded right away to Brownia, but because of her immune suppressed condition, the fever kept relapsing and the remedy had to be taken very frequently, often every hour for several hours until the temperature would come down. However, she had to return to her chronic remedy, phosphorus MM11H. Then on April 23rd, Brownia 1M was begun again, On the 29th, which is just this Wednesday, we went up the potency to 12, as the fever with a cough, headache, shortness of breath, and we kept relapsing. Phosphorus was raised again to another potency on April 30th, and yesterday on the 14th to the 14H. So that means, again, because of our immunosuppressed condition, we have to have very, very frequent repetition of the remedy, and we have to use 2 remedies in our case, her chronic remedy and a remedy more for the acute condition. The 5th complex case is another immune-compromised patient. Is a 16-year-old woman with multiple myeloma, which was diagnosed in December of 2019. She had received limited treatment of chemotherapy and immunotherapy because of side effects. So the side effect was too strong. She had to quit both. But she was immunocompromised. So she developed symptoms like a cold, which developed into pronounced shortness of breath, inflamed feeling in the lungs, no energy, desaturation down to 92. She was given her chronic remedy and would feel much better. Within an hour of taking the sulfur, her saturation would go from 92 at rest to 96, 97 at rest. On March 19, the saturation had risen to 99, but she kept relapsing. Sulfur was increased. On March 21st, the potency was again increased. Again, you can see the same pattern in an immunosuppressed patient. The remedy must be changed very quickly as her chronic condition, the acute condition kept relapsing. On the 29th, she developed sharp chest pain with the most severe headache. She was prescribed Brownia, which improved both conditions greatly. Saturation went up again. She began to experience other symptoms with photophobia. She was prescribed the first remedy she had taken after she consulted me with a diagnosis, which was chonium MM. All improved, but the remedy had to be repeated frequently, 3 to 9 times a day. Finally, the picture changed on Friday, April 10. She had a recurrence of the sore throat with the aggravation of the cough. She was prescribed arsenicum album, and she has remained mostly asymptomatic until her last visit on May 1st, yesterday. Her multiple myeloma profile, which I received the report yesterday, of the last 3 monthly blood tests, because I received them monthly, but I got the one from April 27 on Monday, shows that she's moving into remission. Like she has all the sign of being in remission right now. But again, she's still immunosuppressed, and she's recovering. She recovered very well under homeopathy. Typically, a patient like this would have gone to the hospital and probably would have turned very sour. The last case is a colleague of us. It's a suspect COVID patient. She was tested. She got negative, so maybe a false negative. However, she developed, she says, I probably have COVID. We have had COVID in California for about 3 months. I'm sure there are tons of asymptomatic hanging around. My guess is it was either the bank or the store where she would have contacted somebody. Anyway, she developed fever with extremely painful headache. Much worse on stooping, the classic symptom. Moving the eyes again, another symptom of Brownia, also common in COVID. And the fever alternating with chills, so the typical, but in her case, here we are not dealing so much with the lung problem, but you'll see, first of all, like a very intense headache. She had a positive Brzezinski sign, which is usually is for meningeal irritation, which made her head much worse. So she started on her own. She self-prescribed Brownia 10M on April on her own. She says on April 1st, says, I'm 90% better with no fever this morning. Brownia was definitively the remedy, but I used my temperature to determine how frequently I need the remedy. I was shocked when I needed a 10M sometime once an hour. I suspected I would have been quite sick. I had not had homeopathy. However, the headache and the temperature continued to relapse. And what I wanted to show you is she developed cognitive problem. Yeah, she started to have symptom. She said, I have been having cognitive issue with the headache. I believe I am one of those rare cases where it end up with viral encephalitis based upon my symptom. They have been permanent cognitive deficit. Now is they don't improve with the remedy. Okay, so the symptoms are that's the one I want to find here. I know she had slurred speech, and even when talking to me on the phone, she had difficulty. Oh, it seems it's not there. Slurred speech. Yeah, slurring words. Yeah, here it is. Difficulty focusing. Feel like slurring or speaking slowly. She paused as when she tried to say something. So you could see on the phone, she would pause. She would wait a long time. Brain feels like it just won't work properly. She had a bit of diarrhea with this. So on the 17th, she wrote, I generally wake up without a fever, but it rises to a low grade. Improvement is very slow, but steady. And she sent me this article, What Does COVID Do to Your Brain? So you can read it. And also from radiology, COVID associated with acute hemorrhagic necrotizing encephalopathy, and so on. And so she probably has this kind of symptom, but the point here is you can see is very, very resistant to treatment, and she has to increase the potency. So on April 30th, on Thursday, I told her to stay on Brano as long as is the most indicated remedy, but to increase the potency on a regular basis, maybe only a few days on the DM potency before moving to the MM and then to the MM 1H and upward. The other here is that if progress is slow, you have to increase the pathology. Increase the pathology means increase the potency and or increase the frequency of the remedy, or both. I wonder if it's a good time to answer some question right now. Peter?
I've got some that I've sent along to Alex Becker. Alex, do you hear us? Can you, are there questions that you would like to have Andre answer?
Where did you send them off to me? Are they under the Q&A?
To your email address?
Oh, okay, great. Okay, I will take a look and then.
Yeah, you could interrupt me a bit later.
Okay.
Okay, very good. Okay, so I will share here now my experience in a nursing home. I had heard that a colleague, Dr. Frederick Rirol, had an epidemic of COVID among his residents in a nursing home in Lyon, France. He was the only physician on staff around the clock for 7 days a week for 120 residents, mostly between 85 and 105 years old. It's a 3-level home. The ground floor has 27 Alzheimer residents. The first floor, it's 53 non-autonomous and severely mentally, like dementia, or physically handicapped residents, like quadriplegic, following stroke especially. And the second floor were 40 less dependent residents. On March 17, when Frederick Rirol heard of the beneficial use of camphora in Iran, he gave 1 dose of camphora 1M on 2 successive days to 118 out of the 120 residents, I should say, and the majority of the staff. On March 19 and 20, about 25 residents of the second floor only developed diarrhea, which was not serious and self-limiting. So we cannot assume it's COVID, because unless it was a variation of the virus, because it was only on it was on the same floor only, and all had the same symptoms. So more likely relate to something else, another bug. On March 19 onward, the first 6 cases with flu-like symptom with fever made their appearance, but only on the first floor, so the middle floor, only there. Okay, and then about 9 others became febrile in the following days. Fred thinks that eventually all 53 and certainly 40 of the first floor residents became infected. Within 2 days, 2 had died. In total, 11 would die, 10 in the nursing home, and the only one who was hospitalized. Incidentally, the 2 residents who refused to take camphora were among the first one to die of the 11 who have died of COVID. When Fred saw that the epidemic was taking all of the first floor, he treated everyone affected with brownia. All got better quickly. However, 2 days after he stopped giving brownia, and that was a mistake because he did not know, but now he knows better. You don't stop the remedy because you will have a relapse. That's guaranteed, almost guaranteed. However, 2 days after stopping, he stopped giving brownia. A number of these relapsed. He resumed brownia, and they all improve again. However, some of these became worse with time, and I would assume that the one that became worse with time was probably again a problem of pathology. You saw how the pathology had to be used in very complex case, and here you're dealing with very handicapped, physically and mentally handicapped people. And for these, we had to use remedy adapted to each case, which saved 6 severe critical cases. Saved from death because they would have died. He has had no COVID case on the ground floor or second floor. However, no staff was allowed to cross from the other floor to the first floor without changing their entire PEP. Dr. Riol in the beginning had access to only 3 COVID tests and was able to get more later on. So finally, only 12 patients were tested for COVID and 9 tested positive. However, the 3 who tested negative must have been false negative, as they present a typical clinical picture of COVID-19 with respiratory distress, and 2 of these died. 2 of these 3 that tested negative. Fred wrote, for the follow-up of the very serious cases, I was helped by Andre Saine, who I thank again, who, thanks to the time difference, ensuring the follow-up at night by telephone from Canada, because for some of the vital prognosis was very pessimistic, and the remedy had to be adapted at every moment, basically hour per hour. Many cures for severe case of 2 or 3rd stage disease have been tried. I can mention carbovegetabilis, kali carbonicum, beryllium metallicum, ammonium carbonicum. He forgot to mention, I'm mentioning it, antimonium tartaricum, opium, arnica, belladonna, gelsemium, arsenicum album, and I can add more, but I think he adds them. It would be Eusiamos here for sure, which temporarily affect no cure. The most useful remedies that have cured serious case, desaturation requiring oxygen by mask or up to, he says 8 liters, but I think it was more like 9 liters, maybe. I think 9 liters, yeah. I know one patient was 9 liters. Or carbonium oxygenatum, carbon monoxide, for asphyxic form, and Eusiamos for major confused form, and a case of ammonium carbonicum given at the very beginning of lung congestion before desaturation. For the convalescence phase, I have the impression that kali carbonicum or sometimes opium have a positive effect. I don't have any experience with silica yet. So this is always Dr. Riol writing. And for the early phase, brownia still is still in the lead. To support Dr. Real in his heroic task, because you have to understand that he had 120 residents to see every day, 5 days a week, and he would follow them. Sometimes it would be 6 days a week. He would take only Sunday off. And during the epidemic, he would take just 1 day off, except the Easter weekend, he took the whole Saturday and Sunday. But he would follow the patient, regardless, he would follow the patient by phone on his day off. But try to imagine, he had 120 people to visit every day. He would visit them all the day, every day. And at one time, he had dozens of people with COVID on one floor. It's quite a task. So on April 1st, I contacted Dr. Real. I offered my help. I did 19 consecutive night shifts of 9 to 12 hours each from April 1st to April 19th. Dr. Real would come to the nursing home at 9 in the morning and would leave around 8 in the evening and sometime later. I would take over from about 8 until 5 or 8 in the morning, their time, the next morning, Central European time, or at 2 p.m. my time to 11 to 2 a.m. Eastern time. I did this despite having an already extremely busy practice of my own. It is interesting to note that after the introduction of carbonium oxygenatum on April 7th, there were no deaths for 10 consecutive night and days. Personally, I was in shock when 2 patients, Madame Jackie and Madame Perrault, died under my care, as in 40 years of practice and close to 300 cases with pneumonia of all degrees of severity. I had never lost a single case. I was in shock, partly because 2 nights before I had stayed up until 2 o'clock in the morning, my time, Eastern, my time, to keep Madame Perrault alive. She began the night with an oxygen saturation index at 84 and a pulse at 65. However, at 2 a.m. European time, she began to desaturate down to 70 with a pulse of 48. Clearly, she was dying. Clearly. I was in contact with the nurse every 20 to 30 minutes. Yeah, until 8 o'clock Central European time. And we were able to stop the downhill spiral. She had entered and kept her alive until Dr. Real was able to arrive at the nursing home at 9. He went directly to see her. However, Madame Perrault died on the night of 2 nights later, on the night of the April 18th. She had been relatively stable all evening with an oxygen saturation at 73, and then it climbed at 75, 77, 78. So we're fairly good. But when I called the nurse at 2 in the morning, because I knew 2 nights before she had desaturated, and I think the night before also she had desaturated around 2. So I said, why don't you go in her room? I asked her to go in the room so she could describe me how the patient is now at 2 o'clock in the morning, because it was 2:15 actually, because we knew of prior 2 nights, to obtain the report of the 6th patient under observation. And she told me, Alexandra told me, that's the nurse. I have to tell you that there's only 1 nurse for a night shift per floor. So there was 53 patients, there was 1 nurse. Of course, they did lose 11. So there would still be like 42 patients every night for the nurse to take care, and 1 or 2 helpers. And sometime on the weekend, like the Easter weekend and the other weekend, it was not even a nurse. It was a student nurse, like a 3rd-year student. I remember there was one. It was her first night of work as a nurse, as a student nurse. She had never even worked before, and she had a patient die that night on her hands. It was a patient that was 97 years old, and he had a massive intestinal bleeding. It was not a COVID patient. And she described to me that, it's just a massive bleeding. And I prescribed a remedy which they didn't have or they couldn't find. And an hour later, he had died. The man had died. So it was very difficult, the first night of work for a young student. Anyway, so I told Alexandra to go to Madame Perrault's room, who she told me had a temperature of 36 as she goes in the room, oxygenation index at 68, not good, and a pulse at 58. Remember, she was at 77 earlier in the night, maybe an hour before. She told me that her breathing was less labor and shallower. I knew she was sinking again, as she had done at the same time 2 nights earlier. I then asked her, I asked her to go to her room. And while she remained on the phone, Alexandra told me that as she's approaching the patient, she didn't seem to be breathing anymore, and that she had become completely relaxed. I asked her to get the oxygenation index and the pulse rate, which were 66 and 49 respectively. So of course we were losing her. It had dropped from a few minutes ago. And at that exact moment, Alexandra told me that her pulse had stopped. Afterwards, she said she had gone quietly like an angel. So that was a bit of a shock for me, because it's not an experience I've had before, to lose a patient with pneumonia. At that moment, Alexandra and I took a moment of the night to talk about our experience in the treatment of these severe and critical COVID patients. At this moment, I learned a bit more about Madame Perrault, because I don't know much about this patient. I don't even have the chronic condition. I don't even have the age. She was 91 years old with dementia from Parkinson's disease. She was completely non-autonomous. She was in diaper and had to be fed by the spoon. She had not talked or moved her limb in over 2 years, and no one had seen her eyes during this period of time of 2 years. So she was really at the end of her life, but still. So from long personal experience, and the one of other homeopathic physician, it is difficult to imagine a person dying from pneumonia as long as a competent homeopathic physician is at the bedside of the patient and has an adequate access to homeopathic remedies, even in patient in the direst condition, such as the one who are on their deathbed, whether the implicated microorganism is viral, bacterial, or fungal, regardless of the severity of the illness, the underlying complication, the age of the patient. So here, nobody should really die of pneumonia. I strongly believe that in a better therapeutic environment, a patient, even as frail as Madame Perrault, should not die of pneumonia. In order to achieve this, a greater number of personnel would be required to monitor patient. Here we had 1 nurse for 42 people, about, more closely with direct access to a homeopathic physician. Here I would have to call only every hour, sometimes every half hour, but if there's a problem in between, it was difficult. And to an adequate supply of homeopathic remedy, because I would say 1/3 of the time I would prescribe a remedy, they didn't have the remedy or they didn't have the potency. So at the beginning, they had potency 7 CH, 15 CH, and sometimes 30 CH, but we need much higher. But at the end, we had the higher potency, where we had access to the higher potency towards the end. It would even be better if the homeopathic physician was able to examine each patient individually and have access to the prior history of each patient. I had no knowledge of any history, no subjective symptom, no prior history of the patient. But there were 4 positive outcomes from this experience. Despite the very difficult and unfavorable therapeutic condition at the nursing home, greatly understaffed, poor access to the remedy, and poor range of potency, and in my case, no direct access to the patient, and no access to the file of the patient, there are positive aspects of our experience in this epidemic at the nursing home, which are certainly 22 of 40 of the highly mentally and physically handicapped and non-autonomous patients who were clearly infected, and perhaps up to 35 of the 53 of these who are suspected of having been infected were saved from going into the severe or critical state. Not a single patient on the ground or second floor, and no one of the healthcare personnel was infected. 6 of the residents were saved out of the severe or critical state. For 10 consecutive day and night, we had, as a rule, 6 patients in and out of the severe critical states, and we had no deaths. However, eventually everyone became exhausted. The personnel became exhausted. I became exhausted, and the quality of care suffered. So sometimes I could feel that the nurse, I said, I'll call you. I would have said an hour, but I could see that the nurse was exhausted. So I said, I'll call you back in 2 hours. So we couldn't properly care for the patient. These 4 positive outcomes would not have been possible without the use of homeopathy for both the prevention and of non-infected patient and healthcare personnel to become infected, and infected patient to progress into the latest stage of the disease. And for having saving the lives of 6 patients out of the critical stage of the disease, despite the fact they were all highly handicapped patients. Okay, maybe we can pause here. Alex, do you have any questions?
Okay, very good. So I'll go ahead and read some of the questions that we have. The first question says that some of the homeopaths are saying that treating patients with severe pathology like cancer, etc., in stage 2 or 3 of corona can be helpful. But I guess the question is, the concern is a deep acting remedy can send them to euthanasia. Is that true?
Well, really, this is not really the subject of this webinar, but no. Yeah. If people are on the verge of death, like they're taking the last breath, and let's say they're extremely anxious and in great distress and so on, and you give them a remedy, well, many things can happen. They can recover. I've seen people recover and being better for months and months and months. Other may quiet down, look around the room, be very quiet, close their eyes, and take the last breath and expire. So yes, there are many different responses. So it's not for the physician to know what will happen. The role of this physician is to, in such a situation, is kind of give the last right, and you give the indicated remedy. Sometimes I've seen people on the deathbed, and let's say with cancer, and they have survived months and months from that situation where they were on the last breath.
Okay. Next question, should we have to mass vaccinate one day or simply be refused access to travel, etc.? And how to antidote? I'm assuming they're saying how to antidote the vaccination if we have to receive it. This question is in many people's head, and the questioner says, all I know is Stuya 200 or wait for symptoms, question mark.
No. You always have to individualize. The poor way to practice homeopathy is to give remedy because routinely. So the fundamental rule of homeopathy is individualization. So if somebody has intoxication, whether it's from food poisoning or heavy metal or any toxin in nature, including a vaccine, you have to individualize the case and prescribe according to the symptom of the patient. That's the rule of homeopathy, the golden rule, and it works. It works all the time.
Next question.
And you would antidote by according to the presenting symptom of the person. Okay.
The next question, we have a long question. I'll summarize. This is that there are 3 individuals that are being treated. Some of them have been treated with different remedies, Beryllium, sulfur, Napmure. Some improvement is being seen. It's about 5 weeks. This from the time their symptoms began. So I'm assuming the patients are not fully recovered. So he says, quite puzzling that they're not yet fully recovered despite homeopathy, immune boosting, nutritional therapy. Question is the expected course of recovery with COVID-19. His experience is homeopathy helps manage symptoms but does not shorten the length of the illness. Is this something that others are finding? Or is this pattern a sign that the choices of remedy have only been palliative and not the simillimum?
No, it's more complex than this. This is like trying to develop like make a certain generalization from cases. Now, listen, you've seen the New York case. She had recovered within 18 hours. But if a person is immunosuppressed, it will take much longer. If a person has an underlying condition like cancer, an active case of cancer, it could be a very complex case. And that's why I present these cases. So no, recovery will be individualized. There's no immediate recovery for everybody. That would be a false generalization. That applies to everything in homeopathy for all kind of condition, acute and chronic. Everybody will have a recovery that will be proportional to, or that will represent the totality of the situation. So their age, their health condition, the environmental access to remedies, and so on. So it's a whole picture, and some case could be slower, some case could be very, very quickly. As a rule, if you look at the cases from the series of cases from Turkey and the severe, they all recover fairly quickly. As soon as the remedy is given, they get better, and then they recover. The recovery is relentless there. The case that I present, complex case, these were complex case for reason of having an underlying condition of being immunosuppressed, lung cancer, multiple myeloma, and so then it becomes more difficult, but you apply the same rule of homeopathy, individualized pathology, and you follow the patient, you follow the rules of prescribing, and you will arrive to success, but it might be more difficult. It's not a question of, or we're giving a simile and so on. No, it's a question of, can the patient be cured when they're immunosuppressed? Can they respond very well? So it could be a bit more difficult.
Okay. Next question. This is, during the first presentation, there was a suggestion that bryonia be used as prophylaxis unless someone is fearful.
Okay, we're going to go that. We skipped this question because we didn't do the Mathematica. So maybe we should just go back to the lecture. We did a few questions. So keep the question, and the one that I don't answer, we'll address them as
later. Okay, we'll go back. Okay, very good.
Okay, very good. So let's go over the Mathematica now. So again, the key to success is always to individualize, each patient at each visit. Okay, so here I say, instantly in the series of 5 cases, 5 severe cases, each patient needed a different remedy. The key for differential symptom, so the modality of the cough would be very useful. So like the most common have been worse taking a deep breath and talking. So others would say worse laughing, worse exertion, worse ascending stairs. So these are the most common. Modality of the headache are very important. So the character of and its character, so the type of headache. So flexing the head and stooping have been like kind of a rule in the headaches of COVID. So the modality would be important. The thirst would be very important. So many will have a dry mouth with or without thirst. So you'll have to look at remedies for that. And temperature of the water to drink. So if the patient goes from, let's say you have a phosphorus patient, like I think one of the patients, I think the one with the lung cancer, she was having, always want to have cold drink, ice cold drink, and then she went to warm drink. Then the remedy was changed to, because of the temperature of the drink, to a bryonia. So bryonia can crave cold, warm, and hot. So the temperature of the drink will be very important. I didn't put it here, but the disposition of the patient would be important. So fears and anxieties and irritability and desire to be alone, aversion to be disturbed. Things like this are very, very important for differentiation. I said modality of pain also I should put here. Modality of pain, i.e. chest pain. Low back pain. Many people have back pain with the COVID. It could be related to the kidney pain. It could be joint pain. A TC. Okay, so it will be very important. Pathology. This is an extremely pertinent subject. When the first symptom appear, I tell the majority of patients to take the remedy every hour, sometime every 15, 20 minutes in very severe case, like to say somebody would have a very severe headache, for 3 doses and to reassess. So when I work with Dr. Diller from Istanbul, I say, okay, this is the remedy, given the remedy every hour for 3 doses, and check after on the 4th hour, check if the patient is better. If it's the right remedy, the patient will be markedly better. Markedly means 50 or above. It could be at the worst would be 20, 30%. That would be the worst, but typically it would be 50 and above, like after 4 hours would be of taking the first dose would be. So let's say the patient received the remedy at noon. They take it at noon, 1, 2. The patient is checked at 3 o'clock. So it would be only 3 hours, actually, 3 hours, 3 doses. And at that moment, at 3-hour point, the patient should be anywhere between 20 and 80% better. And by the next morning, because most of the healing happens in sleep, the patient will be much, much better by the morning. If it is a remedy with a high degree of similarity, there will be a clear improvement, let's say, after a 200 or a higher potency after 3 hours. Unless you are dealing with a complex case, such as an such as immune deficiency. As the COVID can be very persistent, the remedy must be continued as the patient is recovering and after the recovery of the patient. Otherwise, there is a major risk of a relapse. The best remedy for homeoprophylaxis, the more we progress in this epidemic, the more Brownia appears to be the best choice for prevention. Many factors must be considered for optimal prevention, which would greatly depend on the genus epidemicus in the area of a person living. So if somebody asked me, what would be the best remedy to prevent? I was asked this question actually during another webinar. A person from Africa asked me, what would be the best remedy to use in Africa? It was in Ghana, I think. And I said, well, get a few cases that have COVID in Ghana, find out which remedy is being most successfully used in these patients, and then use that remedy as a prophylaxis. But aside from this, if in one area, if no remedy have been found better than Brownia for both prophylaxis and therapeutic purpose, then Brownia should be chosen until proven otherwise. The optimal potency and repetition for a person or a group of person can be crucial for optimal protection, and they would be chosen according to the risk of exposure, potency available, and sensitive patient being protected. So for instance, many people will say, I stay home, I have no contact with anybody except once a week I go shopping for the family. So the person going shopping for the family, I say to use 2 pairs of gloves. They could use surgical glove or painter's glove, any plastic glove, or they could use a glove to protect against the weather, but they have two pairs. They put one in their pocket and one on, and they go to the store with that glove, so they put it on so they don't forget once they're in the store to put them on. It's because when you open the door, you take the cart, that's where you have contact where people put their hands. So you put the gloves before you leave the home and a pair in their pocket. And once you are finished shopping, you put all the grocery in the cart, you shut your car, and then you remove those gloves, put it in one pocket, take the other pair of gloves and put them on, because now you're going to drive the car with a pair of gloves that has not been used in the store or to touch the grocery. And this pair of gloves is used to unpack the food, and then this pair of gloves is taken off, the hands are washed, and these gloves can be put in the sun, or they can be just can be washed, or they can be put in just like this in the air, and they will be decontaminated in a very quick time if they're not wet. However, for negligible exposure group, this is people that are self-quarantined who have hardly ever see people outside. The 30 or the 200 once every 4 weeks would be sufficient. For the minimal exposure risk, that is people, like I just mentioned, they go outside once a week for food. They could take a 200 once every week or every 2 weeks. Should be sufficient. And again, if the person is very sensitive, then go down the potency and give it less often. The more moderate risk group, that is people who occasionally meet other people who could be carrier or have mild flu-like symptom or a cold, i.e. a teller at the food store, a 200 or once a week should work well. For the high risk group, that is people who are in contact with suspected COVID or with COVID positive person, like healthcare workers, a 200 C once a week should be sufficient. For the extreme risk group, that is healthcare professionals who work with COVID patient, like let's say a dentist or somebody who does intubation, you're face-to-face with these, a 200 C potency should be taken every 5 days. For all risk group, the potency should be raised after every 6 doses. That is from 30 to 200, from 200 to 1M, and eventually from 1M to 10M. As the potency increase, the interval between those should be increased depending on a person's individual circumstances. The best remedy for therapeutic is always the minimum in each individual case. The most commonly and successful prescribed remedy as far as May 1st has also been Brownia for all stages of COVID. Also, it has been found by many reliable clinicians to stop the progress of flu-like symptoms when people begin to be symptomatic in area in which COVID is endemic. I'm not sure what it means. I mean, I wrote this a while ago. Also, it has been found by many reliable. Okay, I'm not sure what I meant. For the severe case, we'll go over that a bit later. Yeah, we talked about it before. So some of the remedy for the severe stage. Here's some summary for Brownia. Perhaps 60 to 70% of the most critical case. Of the not critical case. So the not critical case, but it can still be used in critical case. Characteristic by profound weakness. They prefer to lie down and prefer not to move at all and not be mentally active. So they don't want to listen to music. They don't want to watch screens. They don't want to read or talk to anybody. They just don't want to be disturbed. But they prefer not to move because of weakness. They sit for a short time and then go back to lying down. They wants to be quiet, and they have difficulty to move if they have to move. They prefer to be left alone and not be disturbed. They tend to not be anxious, but they can be. They feel as if the lung do not inflate enough. They have wheezing. They can have wheezing respiration, cough, worse inspiring, deep breathing and talking. The cough tend to be painful, especially the chest wall, trachea, throat, and back. Nausea and vomiting from coughing. So I will not go over all the symptoms. I will leave you to read them. There they will have a dry mouth. So I'll let you read all the symptoms. Epistaxis. D-dimer was elevated in 2 cases with brownia, procalcitonin, CRP, ferritin, all, and troponin 1 means heart inflammation of the heart, LDH, all acute phase reactant of inflammatory reactant. Phosphorus, the key here to phosphorus, they're very thirsty for ice cold drink. It's almost a sine qua non. Almost. Once we had an hospitalized patient with COVID. After being very thirsty, went to lack of thirst with a dry mouth, but it is unknown if it was due to allopathic drugs that were given. The phosphorus patient tends to be anxious, depressed, hopeless about being sick. They prefer consolation and someone to talk to them. One patient had their mother rub their head. They like that. Profound weakness, even just to talk, altered and bitter taste, anosmia. I'll let you read the rest of the symptom. Again, elevated D-dimer, so likely susceptibility to thrombus, or thrombus, possibility of presence of thrombus. Arsenicum album, extreme weakness with difficulty to move, no desire to move, too weak to sit up. They prefer to lie down, but here is characterized by anxiety, panic, fear, tension, restlessness, impatience, weariness. Patient is too anxious to sleep despite great weariness. So I'll let you read the symptom. Sulfur, shortness of breath with very clear modality. Here we had back pain with clear modality. It's not ear, but there was back pain in this case that was at clear modality. Two patients at least. Here are some of the remedy in the more critical stage: brownia, antimonium tataricum, carbonium oxygenatum, carbovegetabilis, eosiamos, opium, ammonium carbonicum. These for sure have helped people come out of the, or help them. And I want to come back to carbonium oxygenatum. I increased the Mathematica on the remedy. I want you to review it. It's very important. I think personally that this remedy should be prescribed in all stages of the disease. Now that I've reviewed the Mathematica of it, you'll see it's more extensive. In this, I gave it the first webinar we had. I gave it, but now with more experience, I think we should try it in many cases. If we look at the repertorization, can you see the repertory right now? The repertorization? No, I'll just go for it like this. Okay, can you see it now? Alex? You see the repertory?
Yes, that's fine.
Okay, very good. So if we look at carbonium oxygenatum, it's not a well-used remedy, so you will not be well represented in the Mathematica. But when I read the Mathematica and I read case of intoxication, I see all the symptom, all the different phase of the symptom. That I say would be epistaxis. Would it be? We didn't see the picture. Let me show you some picture after we do this of the of some of the skin lesion. We saw a few, but not all of the skin lesion. So let's say the purpura, the gangrene of the skin, the vesicular eruption. So I think it could be the genus epidemicus of the COVID, and that's one of the reasons I held this webinar today, because I want to ask my colleagues to try it in different phase of COVID. The problem with me is I have many potency of Carbonium oxygenatum. I must have like 10 or 15. These are old from the old pharmacy of I inherit from Dr. Grimmer and Dr. Hayes, and also from colleagues that Dr. Moskowitz, I took some remedy, and Bill Kurtzos and so on. So I have a lot of old remedies. So I must have like 15 or 20 different oxygenatum, Carbonium oxygenatum. However, it's difficult to get them to the people, because my patient in Turkey, they need the remedy now. If I would send them the Carbonium, it will take 3 weeks to get, so we cannot use it. Same thing in the United States. Many of my cases are from the United States or Europe. They cannot get the remedy either from the pharmacy because they don't have it in the States, and they don't have it. If I would ship it to them, again, it would take a long time, even by courier, because everything is slowed down right now with the COVID. So that has been a problem. But if you do have the remedy, Carbonium oxygenatum, I would ask my colleague to try it in all stage of the disease. Especially if you don't see a clear remedy, I would suggest you try it, especially if you see some of the symptoms of that are present. So, because I think it would be a remedy, it's likely to be a remedy that would it covers all aspects of the disease, from the sneezing at the beginning to looking like dead and no pulse, and asphyxia and in between it has all the different manifestation of the disease. I'll show you now a few articles. Yeah, so let's see. So this is an article from Spain, I think.
Andre,
Yeah.
I wanted to, couple of questions on Q&A. Somebody was asking, as a prophylactic, when you're using prophylaxis, going up in the potency, what were you exactly referring to, going up in the potency when you're using it in prophylaxis?
Well, it says in the text. It's mentioned clearly in the text, so they can read the text. But I'll repeat: if you have used 6 doses, so if you took the remedy every 2 weeks, after 6 doses, it's 12 weeks. You go up the potency because you will lose your sensitivity eventually to that potency. So after 6 doses, you go up the potency. If you took the remedy every 4 weeks, that means after 24 weeks, change potency.
Okay.
So I want to show you some of the article. Yes, this is from Spain. And you see, they took 375 patients with COVID, and they found the lesion in a number of them, skin lesion. And here you have the different, you'll have the acral area that have the erythema. We'll see them. You will have the chilblains. I'll show you. Well, we saw them already. The vesicular eruption, 9% have vesicular eruption. Of the people that develop skin eruption, 9% was skin eruption. And it's monomorphic, like same size. You'll see, I'll show you a picture of it. And the diffuse hemorrhagic erythema you'll see of the skin. You'll see lesions that look like urticaria. 47% of people that had skin manifestation was maculopapular. You'll see them, I'll show you. And the erythema multiforme also, that could be also go into lividonecrosis, which actually you can see in poisoning with carbon monoxide. So here you'll see, here's the chilblains. Here again, the chilblains. Here is the little vesicle that are monomorphic, the same size, all over the body, chest. By the way, you have them with carbon monoxide. monomorphic little vesicle, red little vesicle over the body. Here is the urticaria-like type of eruption. Here again, the little vesicles again. Here's the pus. These are larger vesicles, quite impressive. And here is the erythema multiforme. And here you'll see the livido here that could lead to necrosis eventually. When it's dark like this, it can go lead to necrosis. So that's one. Oop. Okay, so this one is 5-case report of autopsy. So there was microvascular, they find like thrombosis and microvascular thrombosis. So if we look here at the end, I think we saw those pictures too. Yeah, so here you have like the necrosis of the skin. And I think the other one is chilblains and so on. So the erythema multiforme and purpura, which you have also with carbon monoxide. So let's go back to the carbon monoxide. Okay, very good. So I put a lot of new information here. Like I say, I try to add as many symptoms as I could. Maybe 1/6 of the symptom I was able to add to the repertory. I'll show you also some other documents here. Yeah.
One more question. Question Q&A. Repetition of remedies at low intervals. The questioner is surprised that such a pathology does not cause proving symptoms, especially in sensitive patients. I'm curious about the size of the doses used. The frequency, I think, of the repetition of the remedy.
The frequency of the repetition of the remedy is not important. You have to give you have to individualize the potency to the remedy. So if the patient took the last time sulfur you have to go with that remedy, or MM1H, you have to go higher. So the potency is not important. You have to prescribe the pathology that the patient needs to take, that is required for the situation. So no, there's no proving in acute condition and very dying people. Don't worry about that. If you worry about that, you will lose your patient right and left. And so you have to use your remedy in order to save their life, not to try not to have a proving. Sometimes you will have an aggravation. You may have an aggravation if the patient is sensitive. If you have an aggravation, you just change your pathology for the follow-up. Can you see my screen with the Allen's encyclopedia right now? Alex?
Yes.
Okay, very good. So here's Alex, not Alex. This is the encyclopedia, and I put the symptom in yellow that I've seen in patients with COVID. So I saw all these patients, these symptoms here. It's funny because as I'm reading this, I say, hey, I saw this, and I put them in yellow, the symptom that I have seen. Here is the conjunctiva. Remember, it's one of the rare diseases that have ground glass appearance of the lungs, almost uniformly with people with carbon monoxide poisoning. So anyway, I look here. So there was in the encyclopedia, there is all those things. I can give it to you because I've confirmed these symptoms. I've seen them. And here, okay. Here is another one from the encyclopedia again, but this is the 10th volume. In the 10th volume, there was a supplement to carbonium. You see, it says reference number 33, because 1 to 32 was in the original, the first, in I think volume 3, but 1 to 33 is a supplement. And again, in the supplement, like here, you have a lot of urinary symptoms. I didn't have time to analyze because I have one patient with kidney disease right now, that every time she get a viral infection, she get an intense inflammation of the kidney. But her symptoms are, I find them here. However, I was more interested in the breathing, like stertorous breathing, the dryness and scraping of the throat with causing a cough, and symptom that I've seen again in patients with COVID. So when you read this symptom and you read the poisoning of carbon monoxide, then you see, wow, it looks like the whole pathology of COVID is found under Carbonium oxygenatum. So therefore, that's one of the reasons, like I say, I held this webinar today, is to give you an update of where we were. And now we know what direction we're going in. And I would say, okay, Brownia certainly has shown to be a lead remedy, like Dr. Dallaire mentioned, like it's the leader, or Dr. Rayol mentioned is the leader. However, I would suggest to try, especially if you don't see any remedy or the case relapse, to consider Carbonium oxygenatum in your cases. So I will go back now to the Mathematica, to the text, and we will take question after that. Okay, so you'll see the symptom here, and this is the symptom of the that we found under Carbonium oxygenatum. I think we reviewed them during the first webinar. But when you just review this, look, great sleepiness for several days. I've seen that exact symptom in the patient. Apathetic, all the sluggishness. It's like the whole pathology of the disease. Flu-like illness is the most common misdiagnosis of carbon monoxide poisoning. The radiographic change is a ground glass appearance, and so on. So and then I think I have some words of, 3 days after the introduction of Carbonium oxygenatum in the nursing home in Lyon, France, Dr. Frédéric Réal wrote on Friday, April 10th, Hahnemann's birthday. Here is our first case in which Carbonium oxygenatum was prescribed. Frédéric wrote, okay, so we'll move that. I can confirm that the severe form of COVID-19 that I have unfortunately had in older people have presented a picture very similar to the Mathematica Carbonium oxygenatum. It is too early, but now we know that was at that time on April 10th, 3 days after we had introduced it in the nursing home. But I'm happy to be able to give you the beginning of the first result of a patient who has been seriously affected since at least March 23, so about 2.5 weeks, and who was managed to stay alive, but without a stable result, forcing us to switch from one remedy to another with a saturation which remained low between 83 and 87 under carbo-veg. And under oxygenatum, it's Carbonium. Oh no, under O2, I'm sorry, under O2. Okay, so under oxygen, that's what it meant. I'm sorry. Under O2, adenosine fever and severe breathing difficulty. Under Carbonium oxygenatum 200 and then 1M. Since the evening of April 8, the saturation rose quickly to 90-92 and remained stable, no fever, and very good clinical improvement on auscultation. The whole team finds him transformed, rejuvenated, to be followed, but after many failure and death, I regained hope. That was on Friday before Easter, and he was leaving for his weekend. For the weekend, so he left with hope, and yes, we had good result with Carbonium oxygenatum. Why? Okay, here is the last part. Why we should knock at every door to request clinical and prophylaxis trial with homeopathy. First of all, we, with Dr. Diller, we're preparing one trial with the help of Michael Frass from Austria. We're going to prepare both a therapeutic and a prophylactic trial in Turkey. for reason already mentioned above and other mentioned below, everyone in a strategic position should request government and aid agencies to begin as soon as possible clinical and prophylactic trials with homeopathy. We need to knock on as many potential doors as we can, with the hope that at some point someone will listen and realize the great reasonableness of our request, which should be emphasized is for the sake of all. Our arguments for this request are very strong and indisputable. Our 200-year record in epidemic is extraordinary and has never been seriously disputed in over 2 centuries. In the current COVID pandemic, our preliminary results are beyond all expectation, except for the ones who really understand the potential of homeopathy in epidemic and would be surprised that people in severe and even critical stage have recovered fairly quickly. Gently and with little efforts. Third, this epidemic is here to stay, and recurrence of the SARS-CoV-2 epidemic will keep occurring around the world for many more years. Oh, something's wrong. Okay. Hold on a second. I need to correct this because we're going to lose something. Sorry. Sorry for the interruption. I just want to not lose this material. There we go. This pandemic is carrying a very high mortality rate, especially in the elderly segment of our society, and is creating great havoc in people's social life and every economy of the world. No one can predict the long-term health effect of this pandemic on the population, as 11% mortality within the first year in the ones who have been hospitalized and have survived community-acquired pneumonia. So people that have survived community-acquired pneumonia, 1 out of 10 about die within the first year. So with COVID, we have 32% of people that come out of intubation that have kidney failure, so they're on dialysis. We have people with damaged lung, they will have damaged brain, damaged heart. A lot of people that maybe will have COPD after the epidemic. During the 2014 Ebola epidemic, the World Health Organization concluded it is ethical to offer unproven interventions with as yet unknown efficacy and adverse effect as potential treatment or prevention. And we have something that we have good clinical observation to show that it's very efficacious. We have a long track record with no adverse effect. By adding homeopathy as an adjunct to conventional medicine, patient, clinician, conventional medicine, and society as a whole have nothing to lose, but to the contrary, have everything to gain if we obtain the same success as the one that have already been obtained. When homeopathy was previously added as an adjunct treatment in the recent clinical trials during the epidemic of 2 severe viral disease, it was found to be clearly beneficial. For instance, hospital stay was decreased by 2 days when homeopathy was added to the treatment of patients during a dengue hemorrhagic fever, and mortality was 15% less with adjunctive homeopathy. It was 15%, yeah, it was 15% less versus 30% with homeopathy, without homeopathy during an epidemic of acute encephalitis syndrome or Japanese encephalitis epidemic. And neither of these, the trial adverse effect for homeopathy were observed. It would be difficult to understand why a person in the right mind would say no to such indisputable argument. So I am done. Alex, we can go with question now.
Another question that came in earlier is a question about cats and pets, how to prevent, how to do prevention for animals. should we also be thinking about giving a preventative? I think that's the question.
Sure. I know some animals have died that have had flu-like symptom, and I saw some case in the literature says, yeah, animals can develop a COVID, a coronavirus infection and die from it. So yes, you could use the same protection approach as with humans.
Okay. Another says that the patient was given bryonia, developed a stomach ache, and asked what to do about it, even though I've never known anyone to get a stomach ache from a remedy in my 41 years of using homeopathy, so I need help.
Well, stomach ache, it could be many reasons. Maybe a person has a cancer of the stomach. So if you give a remedy, regardless of the remedy, it will bring to the surface a problem that needs to be addressed. Or it could be the return of an old symptom, or it could be a proving symptom. In any case, you have to investigate, individualize the case, and go from there.
Okay. What was the potency that is recommended to get for carbonium? They were asking to which potencies should be.
It will be the same as with any other remedy or a brownia. You can start the case with a 200 and go up the potency after that.
So the ones to buy would be 200, 1M, 10M, and...
That's right. And I would recommend people to really try it, because I think, like I say, it could be a genus epidemicus. Because when you read carefully all the Mathematica and the case of poisoning, and I put a lot of reference of poisoning case of poisoning, and there's probably many more that I didn't read, you find everything. You find almost all the pathology there, the effect on the heart, the effect on the lungs, the microvascular thrombus, the ground glass appearance of the lungs, the chilblains. It's just the vesicular eruption, the erythema multiforme, the skin necrosis, the brain affection. Incredible. The kidney affection. It's just amazing. You find it, the whole thing. You could say the same thing. Perhaps you could say the same thing with arsenicum album and phosphorus and lachesis. Probably you'll see a lot of pathology. However, here it seems to be much more similar to carbonium oxygenatum than to any other remedy right now. Perhaps second to brownia.
What about beryllium that was mentioned before?
Yeah, beryllium and lobelia piperans, I did not mention here. They were tried by many colleagues and myself. They were tried in a nursing home without much success. For instance, not too long ago, I had a patient that contacted me after the previous webinar. She says, I didn't get a test for COVID because I don't want the test. It could be false negative, and I know I have it because I've been sick for 2 weeks, and I feel my lungs are inflamed and have the characteristic symptom, and I'm afraid that my lungs are getting deteriorated because listening to your webinar, you mentioned fibrosis of the lung. So I said, okay. I said, do you have any? I say, write me your symptom, and because probably at that time I was very busy with the nursing home and also helping my friend Sarper Diller in Turkey. I say, describe your symptom, and meanwhile, try beryllium, because she felt like fibrosis of the lungs. And she tried beryllium, and she says that it didn't make nothing, but I received the description of her symptom the next day. And she was a homeopath, so she had access to beryllium, so she tried right away. Made no difference, and I think we went right away to, I think it was brownia, and she got better and almost completely recovered by now. So no, it was tried. It was tried in nursing home. There was some results, but you could see no cure with it. Same thing with lobelia. There was some response, but no cure. In colleagues use it, and I use it in some cases. No. So the symptom that we obtain from the patient are not symptom of lobelia as a rule. If we look at the representation, you'll find out lobelia is very low on the scale. If you look at the Mathematica of lobelia piperans, you'll find some aspect, but you don't find many aspects. So I'll put them aside right now. So just go with the remedy that I mentioned, but always individualize the case every time at every visit.
There's an interesting comment. Recently, there was a New York City doctor who recovered from the physical symptoms of COVID, but committed suicide. Wondering if the carbonium might have helped him if he received it. In other words, he had symptoms of, yeah.
Well, it would have to be individualized to the picture. Now, maybe the patient is a chronically depressed patient, and it went over the cliff, or perhaps patient went into a post-traumatic stress syndrome, which is typical. I to some degree experienced post-traumatic stress syndrome after 19 nights of being up late at night, going to bed after my hours of sleep, and lacking sleep for 19 consecutive days. I felt like, especially when I lost Mrs. Perrault on the night before my last night, I felt like, yes, it would be experienced by many emergency room nurse and physician working intensively and seeing patients dying right and left. Yeah, it's not. It will not be surprising that some of them, when you experience post-traumatic stress syndrome, it's like coming back from combat. Exactly. It was described like this, actually. I was listening to a radio program where they had emergency healthcare professional discussing the situation on the radio on CBC, Canadian Broadcasting Corporation radio, on Thursday. And they described as if they had been to war, because they would come back home, they would be completely exhausted, physically exhausted, and totally demoralized emotionally because of the incredible stress and seeing patients die right and left. Very, very, very painful. And especially the one that worked in nursing home, totally distressing situation. And there would be people like this would be susceptible to go into depression and even consider suicide. And some have committed suicide. Like there was, I think, a director of Presbyterian Hospital in New York, the director of the emergency room, a woman, she committed suicide last week. So yes, these people would be susceptible to post-traumatic stress syndrome, and they have to be, which would need to be addressed, but it doesn't mean it would have to be with, it's not a coronavirus type of condition per se, but it would be anything, anywhere where you feel you're at combat and you get exhausted both morally and physically, you would be susceptible to breakdown.
Someone mentions that if they don't have a higher potency of a certain remedy that I assume is working, can they do their own sort of small potentization and just keep mixing it in the next glass of water and shaking it?
Yeah, they will not go far from doing this. They have to really increase by a lot the potency. When people don't respond to a certain potency, to go to 201, 202, you're wasting your time. You really have to go to the 1M, and 1M tend to not last very long after the 200, so you have to move to the 10M. So going to 201, 202 will not work. So you have to look for pharmacy or colleagues. Sometimes the best way is to find a colleague in your area. Homeopathic colleague, you can look on the website of the American Institute of Homeopathy, or in your country or province or area who practice homeopathy, and see to get a potency. Like this patient in Spain, it was 11 o'clock, she had a panic attack, she couldn't breathe no more, she felt the breath she would not be able to fall asleep, and she was difficulty breathing. So I said, do you have any colleagues in the area? She says, yeah, one. So I said, why don't you call? But even at 11 o'clock at night, I know that in Spain people don't have dinner before 10, but she told me during the pandemic people don't go out, so he may be sleeping now. I say, wake him up. So she phoned him, and he was awake, and the highest potency he had of Sambucos was the 5C. So the mother or the father went to get the 5C, which was 10 minutes away. So 20 minutes later, she got everything calmed down. So yes, you can get it from wherever they can get the remedy. There was a case that I presented during the first webinar of a student who developed COVID-like symptom, but she was in the country. And I told her to get arsenicum 200, but she couldn't get more than the 15C in the countryside. So she went to the pharmacy, and the highest was the 15C. So she did very well. She recovered under the 15C. So you get what you can.
Another question about prophylaxis. Do you continue the prophylaxis through the season or through the year if once one starts it? I also assume that the question is, at a certain point, do you stop the prophylaxis?
Well, as long as something is endemic, that means there are cases in the environment. Not 1 out of a million, but there are more. There's cases in the environment that the condition is endemic. Then, and you look at your risk of exposure. So if it's endemic, you look at your risk of exposure. That's where you make a judgment call whether you need to be protected or not. So that's how you're going to do it. So as long as you're in an area where it's endemic and you have you measure your risk from being negligible, minimal, moderate, high, or very high. So you evaluate your risk and you use the prophylaxis in consequence.
Another sort of.
Oh, by the way, we have a group of about 100 people, mostly in the Midwest, Cincinnati and Midwest, who have been taking Brownia as a prophylaxis now for probably 5 or 6 weeks, and they report to me. None so far have report a symptom of proving of the 100, except one, but it doesn't seem it was related to the Brownia. The person had like a stomach nausea or with an indigestion, but it was not seemed to be related because the person had already taken 2 or 3 doses, like once a week, and never had the symptom, and was not produced the 4th week. It was only in the after the 3rd dose. So it probably was incidental. However, of all the other ones, of about 100 that have been taking the Brownia, as a rule 200 as a prophylaxis, none so far I've seen have report really clear side effect. So if somebody says, oh, I took the Brownia and that's terrible headache the next day, or had severe chest pain or difficulty breathing the next day, or joint pain, or I had no energy and had to be remain lying down, I say, oh, this is a clear proving symptom, but it was not the case. So it's not so easy to prove a remedy. You need people that are very sensitive.
Another question about patients with autoimmune disorders. Are they somehow perhaps a little bit different than your regular patient?
Well, yeah, I had a patient with MS from Pennsylvania that had the flu-like symptom. So that's very complex, delicate condition, because the MS can flare up a lot with flu-like illness. It tends to always flare up. And in this case, she knew, because she's my patient for 2 or 3 years now, and she knew from past experience when she would have flu-like symptoms, she had to contact me right away. She contacted me right away, and we managed it very well. She never got worse. Actually, I think she was even better after the what looked like a COVID. We're not sure what looked like COVID symptom. She was better afterwards as compared to before she developed the acute symptom, as if treating the acute helped the chronic condition. But however, people with autoimmune disease like multiple sclerosis have to be told to be very, very quick to address flu-like symptom during this COVID pandemic. Otherwise, they could sink very quickly. Interesting enough, many clinicians, including myself, that I've seen a lot of people with COVID or read in the literature, apparently people with asthma are not really more susceptible to COVID or to respiratory distress of the COVID, which is interesting. Perhaps because it's not related to ACE receptors. And the drug they're taking, contrary to hypertensive drug, are not affecting the receptors. You have to remember, when you take a drug that blocks a receptor, the cell tend to make more receptors. So if you make more receptor, then more chance for the virus to enter the cell.
Another question about whether we have offered these webinars to the WHO, or whether we have I guess we have contacted some of the authorities on this. I think that's sort of a different political question, it sounds to me like.
So what's the question?
Question is, have we offered these?
I have no clue. But I know that FDA have been approached, and U.S. politicians have been approached, and there's some interest. But this is like moving. They will think about this, think about it and make a decision maybe 5 years later. You know, it's so slow. So I'm not very hopeful in those area. I think the most important people are physician and healthcare personnel that deal with COVID. If they can get this message and try homeopathy, because they can use homeopathy. I gave the mathematics of the few remedies, of a few remedies that could be used maybe in 90%, 95% of the cases, and they can use them. And people that have access to this webinar can ask the physician to be treated with homeopathy because it's extremely effective, preventing them to go into a serious stage. And if they're already in a serious or critical stage, they could be saved with homeopathy, or would decrease the hospitalization dramatically, the time of hospitalization dramatically, and intervention dramatically, like you saw in the series of cases from Turkey, from Istanbul.
Mm-hmm. Someone is asking about the first cases, the representation, and the reasoning behind the cases. Will that be on your notes?
The representation you're talking about?
For the first cases that you
well,
present?
all the paper, the Word document that you saw will be on the American Institute of Homeopathy website, and the Canadian Homeopathy will be available, not will be on, but will be available. So you'll be able to download it from those websites, from the home page of those two websites. So is the recording of this webinar.
Okay. I don't see anything else. I don't know if Peter is on. Does he see any other? There are lots of questions, and I think don't see anything. Did you? Is there something else that you wanted to mention as well?
No, but I'm just looking right now at
Q&A.
Someone is asking if I take prophylaxis. I'm not very exposed, so I did take it maybe the first week or two, but I'm not taking anything because I'm not very exposed. And to some degree, I wouldn't mind having contact with the virus and develop a fever, so I can develop immunity. So let me see if I can see other ones. She says the nurse that was helped by Hendrik and hopefully spread the word. You know, it's difficult. If she says she was treated with homeopathy, she'll be ostracized by her colleague at the hospital. So it's very, very difficult. Homeopathy is a taboo word in the conventional medical community. It's the exact opposite of where it should be. It's demonized. While you know, we could make a good argument of what is more devil-like. Like one has the right to harm, and they do it, and the other ones do not harm and help people and are not allowed to do it. So it's a very ironic situation we're dealing with. However, truth would prevail, and epidemics is the time for the truth to become more obvious. Yeah, go ahead. I'm just reading question that I see on the thing. So anybody heard anything in Cuba? No, I've not heard anything in Cuba. They're using a complex remedy there. I'm not aware. She says, so far we continue with Brownia as a prophylaxis. Yes, we could. You should continue with Brownia. However, if somebody wants to do a trial with carbonium oxygenatum as a prophylactic, that would be another option. But as far as we know, Brownia has worked very well in different situations, in group situations like the monastery in France that we have talked before, and also in the nursing home. There's a long question here about oh, it's too long about prophylaxis. So okay, it's too long. Any other question?
I think a few questions have been for pathology in terms of different different frequency pathology using wet doses and dry doses. A lot of questions have come in with that.
Yeah, I'm smiling because there's a question there. I'll answer it in a minute. Repeat your question.
So there have been a few questions about specific pathology, whether to use wet doses, dry doses, frequency of doses.
Okay. Yeah. So with pathology, it's mentioned in the differential mathematical section. It mentioned how to use the pathology in terms of. Is it better to use dry dose or wet dose? So you can always start with a dry dose if the patient is not too sensitive, and then you follow with a wet dose, because the more you repeat the remedy, the more you want to continue with the wet dose. So if the patient is extremely sensitive to the remedy, you can use a toothpick. You dip the toothpick in the water and you touch the tip of the tongue with it. That's the minimal dose you can take by liquid, and in terms of spatial and quantity and time, just. And if the patient is not sensitive, then what Hahnemann recommends is a tablespoon of the water as a dose. And before each dose, the water is succussed if it's in the bottle or jar, or it's stir if it's in the glass. The glass is covered, and the water will stay very well as long as it's covered, at least for a week, 2 weeks, 3 weeks, as long as it's not cloudy. When it's cloudy, it has to be discarded. And if the water goes down of the glass or the jar, you put more water. You don't need to start another process again. Yeah, why I was smiling is somebody says, those paintings behind you are cool. Who are they? So yeah, this is Adolphe Lippe, and this is, it's Hahnemann. That was, these are original portraits of both Hahnemann. So I'm under very good surveillance. So if I say anything that is not, homeopathically kosher, I will be told right away.
How long? Again, pathology. In terms of preventing relapse, how long does to continue the remedy?
Yeah, it will depend on the exposure of the person. No, for relapse, okay. For relapse, it would depend on how quickly they recovered, their state, like if they're immunosuppressed or not. So you have to make a judgment call. You saw like there was a physician in Turkey that was quite sick, and he recovered fairly quickly under homeopathy, and he quit the remedy when he was recovered. He quit, he never took it back, and never got sick again. So some people may never get sick if they don't repeat, but I would say there's too many people that relapse, don't take a chance. So do it for at least a week, depending on the case, or 2 weeks.
Okay.
You could take a dose before bedtime. You could take a dose every second night or every third night. But at the first sign of a relapse, any flu-like symptoms, sore throat, chills, fever, weakness, headaches, coughing that would come back, difficulty breathing, oppression of the chest, they take one dose every hour of the last potency they took, and they contact you right away as to tell you that you need that they had begun a relapse. It will happen.
Are we keeping data on homeopathic prophylaxis? Another question in terms of hopefully in the next webinar we can discuss this.
Yeah, but it's very difficult because, you know, when you do homeopathic prophylaxis, if you say, oh, I given the remedy to 1,000 people and nobody got the disease, it's meaningless. You have to have two groups.
Yeah.
Or two groups that are, one is a control that with comparable age and risk exposure. It's more the negative results that are sometimes more important in prophylaxis. So you say, I gave Brownia to 20 people and 5 developed COVID. So you say the remedy is not effective. So, and that was the case of the nursing home when camphor was given to 118 of the 120 residents. Close to 53, about 53 seems to have been infected, at least 40 for sure. Seem to have developed all the febrile symptoms typical of the condition. And like I say, 11 had died. And camphor was given, so, but people had argued, yes, but it was given 2 days before the first advent of symptoms, so therefore it didn't permit them to give immunity. And I say this is nonsense, because as you can see, Hahnemann there would say it's nonsense. Why? Because when he gave belladonna in 1799, which is 221 years ago, to children that had been exposed to scarlet fever, he gave belladonna as a preventative to the ones that had been exposed to scarlet fever but had not yet developed the symptom. He gave them, they didn't develop the scarlet fever, but he didn't wait. He didn't give the, that was the preventative aspect in homeopathy. Starts from the moment you give the remedy. If a person becomes sick, it's not a question of, oh, it was given too late, because immunity had to be developed 2 weeks, give them a space of 2 weeks. It doesn't work like this. Unless the person already has the first symptom and you give the remedy as a prophylaxis, it might not work, because then maybe it's another remedy. But if the remedy is given and the person becomes sick, or a number of people become sick, then you would say the prophylactic remedy is not effective. So negative results tend to be more important to know. Otherwise, you need to have controls to know. So let's say you say, we had, in a hospital, we randomly gave Brownia to half of the nurse in a random fashion. So they were randomized by age, by occupation, by exposure, by number of days working in the hospital. Half of them got Brownia, or it could be in an enterprise. Half of the employee got a certain remedy, and the other one got a placebo. And then you compare the two groups. That would be very, very useful. Otherwise, it's more the negative result that are illustrative of the poor effect of a remedy for prophylaxis.
Is there any?
Also, I want to say one more thing regarding camphora. When Hahnemann prescribed, suggested camphora as a first stage remedy for cholera in 1831, when cholera made its advance in Europe, he said, but don't use camphora for prophylaxis. He says you have to use cuprum, the second stage remedy, veratrum being the third stage remedy. He says you have to use cuprum for prophylaxis, because he says camphora is only he said for the flu, it says it's only a palliative for the flu, and he says it will not protect you from cholera, even though it's the first stage remedy. To protect yourself, you need to have cuprum metallicum. So that would be another argument that would maybe for not using camphora during the COVID. Go ahead, sorry to have interrupted you.
No problem. Another question about doing double-blind studies. I think you mentioned that there was going to be a study in Turkey.
Yeah, that's correct. So it's in they have been talking at the university and the hospital. So I know it's working, and you know Michael Frass, which is a researcher that has done work in an intensive care unit with homeopathy, has joined the team. So I work with Sapra Diller from Istanbul, who is a university professor. I made the contact with Michael Frass with him, and they're working together now to develop a clinical trial, both for prophylaxis and therapeutic in a hospital in Turkey, and also in a region of Turkey for prophylaxis. So it's in the work right now. So they're working on it, and they're developing the plan, and it's going to be in effect very soon.
Very good.
However, there was an attempt by an epidemiologist from Holland that had heard one of our webinars. After the webinar, he contacted me and says, you know, I'm going to contact Boiron in Lyon, France, to begin to see if they will be interested to do a trial with homeopathy in nursing home. And Boiron apparently were not interested. They were afraid that it would backlash against homeopathy. So there's two approaches here. One is let's be very careful and not go forward, and the other one is following Hippocrates, which is the oath the Hippocratic oath, which is all physician has done, is we try to save life, and it's our duty to do it, and we have to show what homeopathy can do. Now is the time.
When a patient is being treated for a chronic problem, I assume with a remedy, how would you give the prophylactic remedy if it was given on a weekly basis?
Yeah, so if the patient is taking, let's say, a remedy, let's say they take it daily for a chronic condition, let's say a patient has an autoimmune disease or cancer or a chronic disease. So you keep it away from the chronic remedy and you give the remedy. However, it may not work. If they have an intense chronic disease, the prophylaxis might not take so well. But if the remedy they're taking for the chronic problem is phosphorus or arsenicum album or sulfur, those three remedies has been used successfully in the COVID epidemic. I would say don't use any other prophylaxis because you're probably taking the best prophylaxis by taking the remedy that you respond very well.
The cases, there's a question about the sulfur patients' chronic remedies. Are you seeing many acute sulfur cases during this epidemic?
Not many, but I would say let's say 5%. Maybe more, like maybe 5 to 10%. It's hard to know. I have to think of all the patients, but 5 to 10%.
Okay.
Oh, here's a question. It says, do you have any dietary recommendation to deal with the disease or as a prophylaxis? Yes. So Michael Greger, the real who has a handle on the science of nutrition at nutritionfacts.org, did a webinar on April, the same day as I did one. It's probably the 14th or something like this. Anyway, the 7th of April, I was doing a webinar also on that day, and he did one on how to approach it from a nutrition point of view. However, I would suggest people that when they have fever to stay with water, just to drink water, you will recover much, much faster. And also learn to do hydrotherapy. We talked about it before. So fasting with hydrotherapy you will accelerate any healing process. Yes, Alex?
Another question about ground glass appearance. I think you probably need to clarify that you meant on chest x-ray you have ground glass appearance. The remedy, carbonium ox, and then there was a second remedy you mentioned that in relation to
Brownia also as a cure. It disappeared from the CT scan after the use of Brownia.
Okay.
So two cases were cured with Brownia, and carbonium oxygenatum. We don't have CT scan to show before and after in the nursing home. However, it is the common lesion of the lung in people that have carbon monoxide poisoning, which is very unique and interesting per se.
I think those were all the questions you have.
Yeah, there's some more. It says, why are homeopathy results not mentioned in the media? Well, because the media are not necessarily pro-homeopathy. I remember years ago, maybe 10 years ago, there was a ex-editor of the New Yorker that was working on a book, and she wanted to interview me. She came from New York, and she was also had been writing article for the New York Times for many years, like long articles, 2-3 page article, like on specific subject. And so she was very well known in the New York milieu, in New York Times, New Yorker, ex-editor of the New Yorker. And she was writing a book, and she came to interview me in Montreal, and it was about homeopathy. And she stayed, maybe she stayed for 3 hours to interview me. And I said, are you going to use this information? Are you going to put some of this information in the New York Times? She says, no. We says, we can't. First of all, the editor will never accept this. And second of all, if they would accept that, the journalist that would have written that would lose his career. He would be blacklisted after that. He would be not have a career after that. I said, why is that? Well, I says, first of all, at that time, that was about 10 years ago, so the New York Times received $85 million a year from the drug company. So he says, we cannot publish that because it would be not acceptable by the editor, and the journalist that would write something like this would be barred, as if he had written about voodooism.
Experience with intravascular coagulation, treating with homeopathy. There's a question about that.
Okay, so this we cannot see because it's microvascular unless you have the libido on the skin. And so here, like I say, you have to look at remedy that have purpura. We have it was put in the representation. I will make a PDF of the representation, and I will put it also on the website of both the American Institute and the Canadian Academy. You will be able to download the representation, and you'll see the symptom. So remedy that have purpura, skin gangrene, bed sore, would be would have or clotting of the blood. So anything with thrombosis, clotting of the blood, purpura. So all of these would be very useful for microvascular thrombosis. So to address this, and like I say, Carbonium oxygenatum has it. Brownia has thrombosis also. Microclots in the sputum when they spit out. So you will find this in the representation in the Mathematica.
Where in the representation would you find it specifically?
Oh, you want to show you I can show you. Can you see the representation now?
Yes.
Okay. Thrombosis here. So where you would find like here it says blood clot, sputum. You'll have a tendency for, so we can look at this. So you see here you have brownia for clot in the sputum, a clotted blood, but you can look at thrombosis. Thrombosis here, the different remedy for thrombosis, and then you can look at inflammation of the blood vessel. So again, look, brownia is quite strong here, and you can also look at hemorrhage, and you look at blood, and you look at coagulation. So the blood coagulates. No, does not coagulate. I'm sorry. Let's say clotting. It would be clotting actually. So we'll look at clotting. So
I think you need to refresh. We're not seeing your screen much.
Oh, okay. Sorry. Okay, so you see, where did you lose me?
About maybe a minute ago.
Okay, so here's the hemorrhage, like clots, and you will see that, and you'll see something, look here, I'll put here, dark blood. You'll have dark blood, hold on, dark blood, and you'll see, no, not clots, dark blood. And you'll see Carbonium oxygenatum as very dark blood also. So I was showing thrombosis before. Thrombosis. And here you'll see thrombosis of the legs. Brownia is very strong. I think this is the part you didn't see. So you still see my screen? This is the
yes.
Okay. So then you have like the people that have apoplexy, but apoplexy due to thrombosis. There were 5 cases, an article was 5 cases from New York City that died from thrombosis. They were between the age of 32, I think, and 45, all men with COVID positive, but with almost no symptom. So they were basically COVID positive, but almost asymptomatic. They were in quarantine at home, and they all died of apoplexy, of a stroke. And when the intervention neurologist went in to, they go in with radio imaging to suck out the clots. The neurologist was describing that he could see on the radio imaging other clots forming in other vessel of the brain while he was removing the major clot. And he says he had never seen that in his life, clot forming while they're removing one, and to show you that the process was going on very actively. So, so that would be part of the general pathology of COVID.
Very good. I don't see any other questions, just some general things if you want to look at the...
Oh, well, there's a ton of them in the chat.
There's a ton. Actually, I dismissed most of them.
Okay. Yeah, I'm just looking. I'll see if I see some that are valuable, because there's a whole bunch of them.
Yeah, I didn't see anything. There were a lot of questions that were...
yeah, so they're asking a question about complex case. When there's a chronic disease and the acute, yeah, you have, as Hahnemann has thought, when you have a SORA and you have an acute miasm, what did they recommend to do? He says, treat the acute miasm, the infectious disease. But if SORA comes to the surface, go back to the antisoric. But if you give the antisoric and the acute condition exacerbate, go back to that remedy and go back and forth. So this is, has been mentioned by Hahnemann. Yeah, so you have to do this. You go over the clinical picture. A question is, might we have a webinar in the future regarding post-infection sequelae? Yeah, but we're not at that level yet. Do you believe in the development of immunity? I don't know. I have no idea if there will be, if somebody has been exposed to the virus, if they would develop immunity. You have to beware that when they develop vaccine for the SARS in 2000, after the 2002-2003 epidemic, there was the SARS epidemic, and they developed 4 different vaccines using 4 different methods to do to produce antibodies, and they had to remove those 4 vaccines out of the circulation because people that had been vaccinated, they seemed to accept the vaccine relatively well. However, when they came in contact a year later with a coronavirus that is endemic in the population in the winter, like there's 4 of them in the population, especially infecting children that develop like common cold in children. When these people would come in contact with one of those non-virulent coronavirus, they would develop a massive lung infection and perhaps massive inflammation of the body, and they would die. So it's not obvious what's going to happen to people that have been infected. I think maybe we have went around the circle, right? Yeah, I think we've, oh, there's my friend Sarper. He says, Sarper from Istanbul says, hoping that the next webinar you'll be able to share some data on homeopathic prophylaxis. So he says, because they're going to do the trial. Yes, I hope I perhaps will put them online for this. Somebody says, what about gelsemium as a prophylaxis? I would say no, because it's very, very few cases have require gelsemium, and probably if gelsemium was used, like you saw maybe in 1 or 2 cases, it was just temporary for addressing a certain picture, but it was not, no, I would not recommend, not in this epidemic.
Another question on if one were to alternate between carbonium ox and bryonia as prophylaxis.
It could be possible, but you will not know the outcome of it. Maybe the best thing is to, like I suggest in a hospital in Michigan, to give 1/3, not 1/3, the personnel that were not thirsty to give gelsemium, the personnel that was more anxious and chilly to give arsenicum, and the rest to give bryonia. But today, maybe that was the first webinar we did. But now that we know better, I would say, no, divide the group in two groups, half carbonium oxygenatum and the other half brownia. So I see many other questions, but we more or less cover all the questions, I think, unless there's new ones that are coming in.
We did. I don't have anything new that I'm seeing.
Okay, no, I see many more.
No, there are many more, but I dismissed most of those were either repeats of what we already answered. And
okay, I see. Okay, very good. So I don't think I need to answer anything.
No, you don't need to go through all the list. I went through it.
Okay, very good. Okay, so thank you for attending this webinar. Like I've said, the notes, the repetition, and the recording of this webinar will be available free on the American Institute of Homeopathy website, homepage, and the Canadian Academy of Homeopathy homepage. Both of them have a button for donation. We have received already a donation, I think last week, for $10,000 the Canadian Academy of Homeopathy from a donor. She will make an announcement eventually. We will make an announcement about this. But also for physician and healthcare professional, think of joining the American Institute as an associate member or as a foreign member or as a full-fledged member to the American Institute of Homeopathy. As I've said at the beginning of the program, union is strength. So we need to strengthen our organization, our associations, and help financially both organizations to be able to put up free webinars like this and other educational material and activities that probably will go on throughout this epidemic, which may last a long time.
Thank you, Andre. On behalf of the American Institute of Homeopathy, we are very happy and honored to have you, and we hope we can continue having these webinars and move forward.
Thank you, Alex, and thank you, everybody, for listening. Hope you the best.